Professor Robyn, you have 10 minutes to present your thoughts. We'll give you a signal at 9 minutes and you will then have 1 minute to wrap up. So with no further ado, over to you, Professor Robyn. Thank you.
Thanks so much for your lovely welcome, and it's really nice to be with you today. If it's okay with people, I'm going to turn my video off to try and preserve bandwidth for all of us. So, and now I'm going to share my screen. Okay, here we go. Oops. So I'm really delighted to be able to speak with you today about family poultry, about the different systems and the challenges and the options that we have for contributions to healthy and sustainable human diets by using family poultry. According to the FAO, they have designated 3 broad production systems under one umbrella. So they define family poultry as small-scale poultry keeping by households that uses mostly family labor and wherever possible uses locally available feed resources. They can use one of the 3 different production systems we see below, and they may have many different species from chickens, Muscovy ducks, pigeons, mallard ducks, guinea fowl, quail, turkeys or geese. And as we move here and we see the extensive production system where birds are able to roam freely, semi-intensive systems where birds are enclosed for part of the day and then allowed to roam for part of the day, and the intensive production system. And as this arrow indicates, as we move from extensive to semi-intensive to intensive, the number of inputs required, the cost of inputs required, and the risks involved with production increase from left to right. Family poultry, particularly indigenous breeds of birds, have for many years, many thousands of years, made significant contributions to human well-being and to human livelihoods. In terms of the Sustainable Development Goals, they contribute directly to poverty alleviation, which is through income generation. They contribute to food and nutrition security, which is the Zero Hunger SDG. They contribute to human health, both directly in terms of supporting nutrition, but also in terms of birds being sold if medicines or if expenses are there. They contribute to education, once again, by providing petty cash to be able to buy educational material for children. In terms of gender equity, family poultry are often raised by women, so they can contribute to the empowerment of women. And in terms of life on Earth, SDG 15, if we're able to improve family poultry production in rural areas, often that driver, that incentive for communities to hunt wildlife is reduced because their nutritional and their food security needs are being met by the birds that they're raising. This is my favorite saying, is that indigenous birds, they may be small birds, but they make a very big contribution. In the majority of countries where I've worked, if village chickens are able to make their way, indigenous breed birds are able to make their way to urban markets, they command a premium price because many of the consumers value their taste, believe that they're produced in a healthy way. In rural areas, they're important because they don't need a lot of inputs, and those inputs are simply not available in remote areas. And because of this, really, there's no direct competition between extensive production of indigenous birds and commercial poultry production. They operate in 2 different production systems and often in very different geographies. In terms of efficiency of production, so looking at what the inputs are in terms of the return and in terms of productivity, indigenous chickens are very efficient and have high productivity. In terms of labor and capital to start the work, it's quite low. The birds scavenge for the majority of their feed, and so this is a major saving for producers, that they don't have to buy feed, and also they decrease that competition between the chickens and the people for human edible food and feed. The birds themselves are very smart and agile. They're able to escape predators. They will go broody. The hens will go broody. They will hatch their own eggs, meaning you don't always have to keep buying in replacement stock. In terms of healthcare, unfortunately, this is an area that it would be lovely to see improve, but in many cases, producers often use traditional medicines because that's all that's available to them, because the poultry health services, particularly vaccination, are not always readily available. But when you put all this together and you look at your benefit cost ratio, it's extremely high because you're getting something for a very low input. In terms of rural households, as I discussed under the slide, we're looking at the Sustainable Development Goals. These village chickens can be sold in times of emergency to provide petty cash. If they're going to be consumed at the household level, they provide high quality protein and bioavailable micronutrients. For the ones that scavenge and that can wander through gardens and can have access to other livestock, they help with pest control. And in this particular one, you can see here that this little chick is probably going for some moisture off the nostril, but likewise, they can also be taking ticks off other parts of the cattle. They can provide manure for vegetable garden, providing it's been composted. In many places, they're very important for traditional ceremonies and rituals and able to contribute to social credit. And often they're the only livestock over which women and children have some control. One of the important things in remote areas where your households are mixed farming systems of having some crops, some livestock, and they're dependent on rainfall, what we see is that over the years, and if we look at this, this is just looking at dry season, wet season. Here we're looking at numbers of birds. And what we see in many places is that once a year there tends to be a dying off. Newcastle disease may come through and bird numbers decrease. And sadly, this period of high mortality in birds often coincides at a time when the stored cereal at the household level is also diminishing. And so with a low number of birds, diminishing cereal supplies, it becomes the hunger period for households until they're able to harvest their next crop. And what we've seen in many places, if we're able to introduce vaccination against the key diseases, such as Newcastle disease, we're able to smooth out this line, and that gives households options to be able to choose what they're going to do with their birds. It may be home consumption, it may be sale to meet their needs. This particular slide is just thinking about if we choose to eat a bird and what we're accessing when we slaughter a live bird, and we're able to use all of the products that are available via that bird. In this table, we've listed 8 key nutrients that are linked and are very important in terms of children being able to grow well and not to be stunted. And in this particular image here, this is looking at iron distribution. And this number 5 here is for giblets. And this is showing that the level, in this case, of iron is extremely high in the giblets. And if we look across, and this is primarily the liver, if we look across, and all of these now are for liver, kidney, other organ meats, you've got vitamin B12, you've got vitamin A, and you've got folate being very high. So when you kill the whole bird and you're able to think about who's going to eat what part of the bird, really important to think about what are the nutrients that are in those different parts. And if we think about, once again, this particular slide is showing all of these 8 nutrients, but what we've done is looking at the quantity of nutrients you're going to get per $1 US. So if you buy a whole chicken where you're getting muscle and bone, you'll see that the amount of these muscles that you're getting per dollar is relatively low. Sorry, that's the whole chicken. If you then have the frozen chicken, you can see very small quantities of these different nutrients. But when you look at the price per dollar of giblets, you'll see that you're getting an excellent return on your expenditure, because you're actually getting very high quantities of each of these particular nutrients. So when you're thinking about, choosing your animal source food, think about the nutrients and the density of those nutrients in the products that you're going to purchase. And the important thing when we think about nutrient deficiencies, particularly in places where food insecurity is a problem and undernutrition is a problem, it's usual that nutrient deficiencies are rarely appearing alone. So by eating very dense foods, such as animal source food that has a lot of dense nutrient density, you're going to be meeting multiple needs. So that's been a very quick overview. I'm looking forward to taking your questions, and I'd like to leave you with 3 takeaway messages. And that is that Indigenous poultry have been raised for thousands of years, and their persistence indicates that they continue to fulfill useful roles at the household level. Secondly, extensive and semi-intensive production systems make good use of the scavenging feed resource base, and they therefore reduce food feed competition with humans. And finally, improvements to extensive and semi-intensive production systems through better poultry health and production services should be based on participatory approaches and cost-sharing mechanisms. So when I talk, say, about improving vaccination, I'm not suggesting that vaccination should be free. My experience is that farmers are very logical thinkers, and if they see that vaccination is going to improve the productivity and improve their returns, then they'll make a contribution towards the cost of that vaccination program. So that's looking at cost sharing. It may not be full cost recovery, but some cost sharing. So I'll stop there, and I look forward to your questions and to Dr. Renuka's presentation that's going to follow. Thanks.
Thank you very much, Professor Alders, for that very insightful presentation. So if you have members of the audience, if you have any questions, you can now direct it to Professor Robyn, and she'll be happy to answer the questions.
So I see that there's already one question there in the Q&A. Is it okay if I go ahead? It's Dr. Munira Dilshad, I think from Bangladesh, has asked a question, and that is that crossbreeding of indigenous chickens has been... Yes, it's okay if I go ahead and answer this question?
Sure, Professor. Yes.
Yes, so the question is
crossbreeding
of indigenous chickens has been happening for many years. And she asks, am I worried that indigenous breeds will be lost? Yes, I am. I am worried. And I do think that it would be very important for all national governments to put in place a conservation program. It is one of the Sustainable Development Goal targets. I think it's 2.5, where governments are encouraged to ensure the conservation of their indigenous breeds. So I think this is very, very important, because going forward, we don't know what situations we're going to encounter, and that genetic diversity and the resilience of these breeds is likely to be very important, not only in Sri Lanka, but in many countries, and possibly also to the wider poultry industry, so that we ensure that we have good diversity of poultry genetics. Thanks for your question.
Thank you very much, Professor Alders. So shall we move on to our second speaker for the day? So let me now welcome our second expert panelist for this discussion. Dr. Renuka Jayathissa, and let me introduce Dr. Jayathissa as well. So Dr. Renuka Jayathissa, a national from Sri Lanka, first ventured into the domain of nutrition when she joined the Department of Nutrition of the Medical Research Institute in 1997. She was trained in public health, nutritional medicine and hygiene and Royal London Hospital in the UK. She pioneered to establish the clinical nutrition program for medical officers. She has spearheaded many national level nutrition, micronutrients, and food security surveys and has published in many journals. These surveys catalyzed public policy changes, result in the acceleration of many nutrition interventions. She then joined UNICEF as a nutrition specialist for 5 years. Upon her return to the Ministry of Health, she worked as the head of the Department of Nutrition till 2023. I'm very sorry, the internet connection here is not that stable because of rain. So let me start. So currently, she is the head of the Faculty of Nutrition and Food Sciences at the International Institute of Health Sciences in Sri Lanka. She is also the past president of the Nutrition Society of Sri Lanka and the Sri Lankan Medical Nutrition Association. She is the current president of the SARC Food Association of Sri Lanka and is South Asian Regional Coordinator of Iodine Global Network. She served in many national nutrition committees and WHO guideline committees. She's a clinician, a researcher, and a public health professional. So, Dr. Renuka Jayathissa, the floor is yours. Thank you.
Thank you very much, Dr. Indrajee, for your kind introduction. So let's go directly to the our topic today. That is, my part is just to cover. I think Professor Robyn has covered so many things. My part is how this poultry really help in improving the food and nutrition security situation overall. So next slide, please. So I thought that first I should really emphasize on the global nutrition situation, even a little bit of comparing with Sri Lanka also. In this slide, that if you look at some of the indicators, especially stunting, this ash color bar shows how we should really achieve it in the 2030. That is the global nutrition targets. Now you can see child stunting. Globally, we are really far away than our kind of targets. Even Sri Lankan situation is also, I have highlighted in the yellow color. That's also far, I think it's very high levels. Even the next one is a child wasting, but at the same time, other one is anemia. So when we look at all these nutritional current situations, when we compare with the 2030, our global, the kind of global targets that we are going to achieve, we have a very huge gap. So which shows that we have to really improve these nutritional situations in a kind of very accelerated manner. So we have to look at how this poultry can help in this situation. Next slide, please. So this is another slide I just want to highlight you, but I think that all of you know about it, because how this poultry will improve the food safety, and then how can it be included in our healthy diets, with the healthy diet, and how that even throughout our life course that poultry can get into the our diet and the improving the nutrition and the finally for our health. So this is what we are really expecting with the introducing poultry into our healthy diet. Next slide. When we really look at food and nutrition security, so what do you really mean this food and nutrition security? For a consumer perspective, food should be safe to eat, as well as these consumers should have a confidence in their food supply. So these two parts should be there when we really look at the food and nutrition security. So at the same time that when we look at poultry, that which is one of the inexpensive product as well as it is widely available. So this is another aspect when we looking at the security part, food security part, we have to really look at the affordability and the availability. At the same time, with the commercial poultry industry, as Professor Robyn mentioned, it is providing the employment, and then they get the income and the kind of affordable for the kind of security aspect. And the other thing is in the poultry production, another part, we are always now with the climate change, we all of us are very concerned about the environment, and they usually compared to the other livestock, it use very less water. And at the same time, this, as Professor Robyn mentioned, the backyard poultry, which is actually a kind of very good income for the rural people. At the same time, the rural people's the main traditional diet is typically now even Sri Lankan sitting also staple diet is rice, and it's a carbohydrate rich staple food, but which is having the low in protein. So it will really enhance the protein quantity of the normal diet. So this is what the poultry can really help to improve the food and nutrition security status of the any country. Next one. These are the kind of very few things just to show you when we are always talking about the poultry, we always look at only chicken feed, but we can always think about the other eggs also. One of the key things I just want to highlight, and we all of us know the protein is there, but in the varying quantities. But one of the key things and the biotin, because people tend to take the biotin supplement, but still that you can get your biotin from the egg white, and when it is well cooked, it is well, the bioavailability is also high. And the next one I just want to emphasize is choline, because choline is really necessary for our neurotransmitter, as a neurotransmitter for our nerve endings. So they are that choline which will improve the cognition as well as it is really needed for the kids. The choline is also really, we can get it in the egg yolk. And the other part is especially our diet, that we are having the high level of carbohydrate in our diet due to the staple food of the rice. We have a problem with this omega-3 fatty acid and things. So that's another good fat we can get from egg, especially in the egg yolk. And at the same time, when we look at in that sense, during the whole life cycle, we can get our, especially our essential vitamins and the minerals, vitamins and the especially minerals and the vitamin A, B12, zinc. These are the things which we really have the problems at the moment. So those things we can really get it from the eggs. So this is another important part. In addition to the protein, we can get most of our important micronutrients also from egg. Next slide, please. And this is another slide I just want to highlight. Now, everybody always compare the 100 grams of the things. Now, in this slide, just to look at the chicken egg, which really provide us the vitamin A plus B12 also. Now, when we compare it with the carrot, so everybody will think that carrot has very much high level of vitamin A. That's true, but who eats 100 grams of carrot? So this is another aspect we have to think about. And the dark green leafy vegetable, who is going to eat 100 grams of dark green vegetable? So in that sense, we have to always look at the quantity that you are consuming, that the serving sizes, which are very important. So the next one, the next figure, I'm just showing you the different kind of poultry, ducks, from coming from the chicken to going to the turkey. Different level of the vitamins are there, micronutrients are there. So these are the other aspects we have to think about when the backyard poultries, whether we can really look at other aspects of turkeys, goose, and the ducks and the other poultries also, because they have the sometimes very high level of vitamins than the sometimes chicken eggs. Maybe the size is very high of the bigger sizes of the eggs. Next one. This is then the next question always come from our patients and the consumers, how much we should eat. So this is one of the publications which came up with the Eat Lancet Commission, that especially that in that one they published it in 2019. And it indicated according to that for the balancing of the diet, and about chicken and the poultry were 29 gram per day and the eggs about 13 gram per day. But after that, this was reviewed and it was identified that quantity is not really enough to fulfill all our micronutrient needs, especially considering, I mean, this planetary health plate, whether everybody is eating this type of healthy plate. So after that, it was really considering whether 1 egg per day and the poultry about 40 grams. So this is a one even Sri Lankan setting we have taken for our calculations about the light food-based dietary guideline, about 1 egg per day, as well as about something 30 gram of chicken. This is what we have taken in our guidelines. Next one, please. And the other part is the food utilization. Then the other, because whenever we always look at this nutrition-rich food items, and whether these members in the household, whether are they using it in the same way. And sometimes what we see is they kind of get the household, they have chickens and they produce the eggs, but what they do is they sell it to the market and they buy something like sausages and the other part of less nutritious food. So, and the other problem we observe was before the economic crisis, actually those days the egg consumption was a little bit less, and about 30% of the people were using eggs every day, but it had gone up to the 50-60%. But now with the economic crisis, again, it has gone down, and the eggs and the chicken consumption has gone down because maybe prices as well as availability was also the issue. Especially that whenever we are having the vegetarian diet, I mean, we are not right vegetarians. People eat little bit of meat and the things because with the economic crisis, it's very expensive animal type of food. And then this type of having the small amount of animal source food is really help us to enhance the micronutrient absorption. And especially that this is important to protect it from the chronic diseases also. Next one, please. And when we look at the food stability, this is another part, and especially the small scale poultry production, though we don't much think about, this is a kind of very important opportunity for the schooling for the kids, and we empower the women as well as we try to enhance their income with the food security, and this is a very good thing for the future generation when we look at the production side. At the same time, this healthy and the diverse genetic reservoirs of the poultry, this will help to minimize the kind of future food production challenges. This is, we have to always think up with our climate changes, as well as fighting with the diseases and the new virulences of the recurrent diseases. And the other part is micronutrients, fortified poultry feeds, because we are having the emerging micronutrient problems, especially vitamin D and things. This is now which is coming up. All these things can be really fortified in the feeds, and then most of the time we can really minimize this type of micronutrient issues. Next one, please. So with that, I think my take-home messages are especially that when we are consuming the poultry meat as well as eggs, and as a part of our vegetable-rich diet, which will really reduce the risk reduction, especially with the chronic diseases. And the other thing, we can't forget the micronutrient deficiencies. That also will help to minimize the micronutrient deficiencies. At the same time, we have to really look at taboos, which prohibit the consumption of eggs and poultry meats throughout the life cycle, which has to be adequately addressed. And the other thing is fortified poultry feeds, which will help to minimize the existing and emerging micronutrient deficiencies. Especially we have to think about children and the pregnant women. So with that, thank you very much for your kind attention. So I can take up any questions after that. Thank you.
Thank you, Dr. Jayathissa, for that very brief and insightful presentation. So if you all have any questions to direct at Dr. Renuka, please put them in the Q&A box. And already I see that there are 3 questions, Dr. Renuka. In the interest of time, maybe we can answer one question.
Yeah, they say that are imported eggs safe for consumption, considering the prolonged duration it takes for them to reach the market, and this extended transit time affect the overall quality of the eggs. I think this usually we say the eggs, the expiry date is about 1 month, and I think Professor Robyn can really kind of correct me if it is wrong. But that's to then the store it in the cool temperature. But in Sri Lankan setting, our temperature sometimes it goes up to 35 centigrade, and I don't know that in that temperature we can keep to that level. Usually in the refrigerated temperature, we can keep it for 1 month without any problem. So even the transit time, I mean, when it is, I think transporting and thing, all these issues must have been looking at by all our vet surgeons. So they can really answer this question better than me. And there is another one. Can I answer that? And the importance of eating poultry meat and eggs.
yes,
Would you also recommend eating poultry products? Actually, gizzards and the things are this is something gizzards, and this has a lot of protein, and this is actually the very good one if the people can really consume it. And the liver is another one. Liver has a nutrient rich, especially vitamin A and all this iron man thing. But the main problem is consumption regularly. Every day is not really good, because it has a very high level of vitamin A, and the vitamin A, we know it's a fat soluble vitamin, and it might get toxic. And that's what we always say, that if someone does not have any deficiencies, the routine people should eat only once a week or something. That's a kind of kind of regulation we give it to them. But the gizzards, it's not like that. It has less fat and the things, but it's having the high level of protein. And the next one is nutrient content of eggs significantly different between commercial layer production and scavenging village chickens. Actually, has been the real questions every time, but we have observed with the analysis, there is not much nutritionally differences. But whatever the things the observe is that village eggs are little smaller than, it's something like 50 gram or something, very small eggs. The usually it does not have much difference between these two. Sometimes we see the less cholesterol level among these these village eggs, because they must be picking the things and the eating and the things, but those are not very significant between these two products. Thank you.
Sorry, thank you very much, Dr. Jayathissa, for answering those two questions as well. So since it's raining here in Sri Lanka, and since my internet connection is not good, I'm keeping my video switched off. So again, I would like to thank Professor Robyn Alders and Dr. Renuka Jayathissa for their insightful presentations. And
there are some more questions, and hopefully we still have some time. Is that okay if we keep going with the questions?
Yes, Professor Alders, yes, we can. Anyway, we have to open the Q&A session now. We can just carry on with the questions.
Lovely. Okay, thanks. I might just follow on with that excellent question about the difference between eggs. Dr. Renuka mentioned what they have found, what's been found in Sri Lanka about the difference between commercial layer eggs and village chicken eggs. In Malawi, in Africa, work has been done that has found some difference in relation particularly to micronutrient levels, and also the ratio of the size of the yolk to the white is also different. The village chicken egg may be smaller, but proportionally there's more yolk than white. So when you buy your commercial eggs and they say it's a large egg, it may be larger, but often the ratio of the yolk to the white is lower, and most of the key micronutrients are sitting in that yolk, because it's largely that yolk that's used to form the baby chick that's going to develop. So with all of these things, as with my first answer about the liver, you really need to do your local tests and to enable your poultry industry to work with your nutritionists to do these tests so that these important questions can be answered. The second question there to me was, what do I think are the most important things to do to improve Indigenous chicken health and production? I think first thing is talk to the people that are raising these birds and ask them what their key problems are. What we find in many countries is that endemic diseases such as Newcastle disease, you probably call it Renuka in Sri Lanka, that it's a common problem, and if birds are not vaccinated, you will get high mortality, possibly fowl cholera, fowl pox. It's about working with farmers to identify what their problems are, and if there are vaccines that can prevent those diseases, then establishing vaccination campaigns is really a great idea. And then working with farmers to look at what the birds are eating and their options for using locally available feed resources so the birds can get that dietary diversity that they need. But the starting point is talking with the owners who to see what their priorities are. I hope that answers your question. I think the next question is for you, Dr. Renuka.
But I guess you all have almost answered all the questions that are there in the chat box, the Q&A box.
There is another one, no? We have,
yes.
Yeah, we have been told that poultry eggs are high in cholesterol. This is really a problem.
Yeah,
Because egg yolk contains cholesterol, which is something like 230 milligram or something. But usually that what we recommend is people need about 300 milligram of cholesterol per day. Actually, you need cholesterol, especially to run your brain and everything. Brain is mainly kind of, the cholesterol is very much necessary. You can't have a zero cholesterol diet, because cholesterol is also part of our kind of, you can't say nutrient, I mean part of our diet, because which need some of the part of our body needs cholesterol to run. So at the same time, we always say the 1 egg per day does not really go beyond this our recommended level of cholesterol intake. But if someone is having the high cholesterol, if someone has the medical problem, only they have to be careful. Otherwise, normal people and the normal sedentary person, they can eat the egg without any problem. At the same time, if someone is very active and they are very sports people or someone who spend a lot of energy, I mean, they can have the more than that. But at the same time, we have to see, we don't have in the market 100 gram of egg. This is the cholesterol in 300, 280, 230, which comes for the 100 grams. Our markets are having the only 50 to 80 gram of eggs. So that's another thing we have to consider whenever we are looking at this cholesterol myths. So this is what we have to tell the people. The cholesterol is something essential part of our life at the same time. And taking egg, it won't much. And all the cholesterol that it contain in our diet, it won't get absorbed also. That's another part. So to reduce absorption, we can eat a lot of soluble fiber with that. Then the absorption will also be it won't get absorbed that much.
Yes. So if there are any other questions, the audience, please feel free to put them in the Q&A box. Sure, our panelists would be more than happy to answer your questions. So one more question. Yes, so there is one question. The animal protein requirement can be fulfilled, I guess. Milk and egg only. Is this true? I think Dr. Jayathissa?
Yeah, actually, animal protein requirement, in the sense we say that our protein requirement, about 2/3 you can get from vegetable, and at least take 1/3 from the animal protein. So, I mean, whatever the animal protein we will get from meat, poultry, and anything like milk, eggs, and everything. So anyone can get I mean, whatever the choice that they need, even milk, with the milk and egg, you can get your 1/3 of protein requirement, because other 2/3, at least you have to get it from your vegetable protein.
Okay. Thank you. So yeah, you can send in your questions. There's another question. Yeah, thank you.
Is it okay if I ask Dr. Renuka a question?
Yeah, sure, Professor Alders, go ahead.
I'd be really pleased to know, in your experience, how easy you have found as a nutritionist working within human health. How easy have you found it, or how many opportunities have you had to work with those in agriculture, with the people who are producing the food? How are you finding that collaboration going?
Actually speaking, Robyn, our collaborations are not that great. Every time we were trying to collaborate, and then the people really get into their own silos after that. So this is something like we were trying to do the multi-sectoral nutrition plans and all the things, but finally we get stuck in the one place. So which is very much important. I mean, I feel that this type of webinar, even that coming to the poultry sector and the stocking is very important, because we should really work together. Then only it will be really beneficial for the consumers at the end.
Yes, it's a great dream, and it's not only Sri Lanka where we don't have that coordination. I'm calling in from Australia, and we could do better on having our public health nutritionists working with our agricultural department as well. It's a problem, but it's one that I think it can be really enjoyable. And as we move to, they're talking about circular economies. As the people who are producing the food are being asked to demonstrate the quality, it's the human nutritionists that are going to really help to understand what needs to be produced in order to meet those requirements. So I think the future is bright. We just have to keep trying.
Exactly.
Yeah, any more questions? So maybe until we receive a question, Professor Iona, we couldn't display the results of the first poll we put up. Until we get questions, maybe.
Can you
is
see
it possible to show
result?
the results of the first poll? Yes, we can. Yeah, so the majority of the participants are, say, undergraduates, and then early career researchers and government officials, and none of the above. We have 6%. Yes. The second poll, the second part of the first poll. Yeah, so the question there is, in your opinion, the role of semi-intensive, extensive, and backyard poultry in Sri Lanka, it's going forward. So most of the participants have stated that it's there to support household income, food security, and cultural practices. Actually, 51%. Then 13% have said that to conserve indigenous poultry genetics. 5% stated that of little benefit and it should not receive too much attention. And 31%, options 1 and 2 are both important. Yeah. So yes, thank you very much. So there's one more question. So it's directed by Hishani. It says, commercial poultry industry believes that family poultry threat for them. Is it? It must be threat, right? Yeah. Let me correct the question. It says commercial poultry industry believes that family poultry is a threat for them. So, what is your opinion? Maybe Professor Alders, you will be able to address this question. Thank you.
Thank you. It's a very good question, and it's a question that's asked in many countries. And my response is that it's very important in each geographical setting to do your own risk assessment. In my experience, where you have commercial settings with good biosecurity that are established in areas without direct contact with villages, then usually there is limited problem. My understanding is that with the big waves of epidemics such as avian influenza H5N1, while family poultry may have been involved with some local distribution, globally It was commercial industry such as the movement of egg trays, movement of eggs, day-old chicks that also helped with the movement of those diseases. So you need to do your risk assessment, and most importantly is ensure that biosecurity is implemented and is tailored and is appropriate for the different settings. But in my experience, the diverse genetic diversity of birds within the indigenous chicken population has its benefits, and provided that the commercial industry does good biosecurity, those scavenging poultry shouldn't be a problem so long as they're not in the immediate vicinity. I'm not sure if I've answered your question well.
Thank you. So, audience, members of the audience, you can even raise your hand and ask a question directly from our panelists. If so, please raise your hand and we will direct the question.
Also looks like the final poll question has been launched. So
Yes.
people probably are also busy answering that question.
Yeah, if you all have any questions, please do raise your hand, or you can type it in the Q&A box and direct it to our panelists.
I think we have reached saturation of the answers, so I'm going to end the third poll question.
Right. Thank you, Prasanna.
And these are the results.
So yeah, the first question is, in my opinion, support for semi-intensive, extensive and backyard poultry in Sri Lanka should be increased, especially to provide access to vaccines and other preventive medicine and support conservation of indigenous poultry genetics. So 26% agrees with that. And then the next one is increased to enable poultry health extension workers to work in it and eggs by children and pregnant and breastfeeding women, I guess. So 36% has agreed with that. I mean, like Susan, right? And I think 36% again has said that both options 1 and 2 are important. So if there are no further, hold on. Yeah, so there is one question directed towards Professor Alders by Ujani Gunasekar. It says, Professor Robyn, what are your thoughts on the potential biosecurity threats to large-scale poultry operations posed by backyard poultry?
Yes. So what I'm going to say is that I think the threats go both ways. So it's true, if there is intermingling of those populations, diseases can move both ways. It's also possible that, for instance, when spent hens are sold and moved into village settings, that they can also move infectious agents with them. There have been cases of this demonstrated. So I think what's really important is that the large-scale poultry industries, where possible, really operate in spaces so that they are physically removed from populations of family poultry and have physical barriers also to stop wild bird entry, rodent entry, those sorts of things. So if it is a large-scale operation, it's a huge investment. And so investing in those physical barriers and in good practice for workers, such that workers that are working in your large-scale sheds should not be keeping backyard birds at home. These are basic principles that I think are very important. But I hasten to say that where you have movement of populations between large-scale poultry industry and the more backyard settings, possibly via live bird markets, you're going to have infectious agents moving in both directions. So the important thing is really do your risk assessment, identify your key priority areas, and make sure that you have biosecurity practices in place. If we have a chance to talk, I'll be visiting Sri Lanka in a week or so. Happy to talk with you at length on this topic, because it really is very important, particularly for those of you who have got significant investments in your poultry facilities.
I think, Professor Alders, we might have time for one more question. And there's one more, I guess, interesting question here. Are there any strategies proposed to overcome basically the biosecurity threats in backyard poultry?
There are. And one of the important things is, first of all, is to understand your system. So where you have birds that do not leave an enclosed area, then you can manage that as a single unit. Where you have birds that are very good at flying and you have more extensive systems where birds may move from household to household, then you have to have a different method. In that case, where you have birds that are free roaming beyond the confines of the household yard, that's where you have to have community agreement on how you're going to implement your biosecurity procedures. Once again, I'm very happy to talk on this topic, and if we have a chance when I'm visiting the university or in discussions during the week, I'm happy to also share some references with you that have specific guidelines where you've got extensive production systems on how you keep disease out, and if you do get disease, how you limit it within those settings. So it's a little different because the network involved is different to what you're dealing with large commercial installations. Over.
Thank you. I guess, yes, we are running out of time for our Q&A session. Yeah. Yes. So, yes, so there are no other questions. No, yeah, I don't see any hands raised as well. So I guess we have come to the end of the Q&A session as well. So hold on. Professor Anna, do you want to ask a question or an answer? I think yes. No, we've come to the end. So yes, thank you very much, Professor Alders and Dr. Jayathissa. So before we end, I think to wrap up, shall we look at the key points presented today in this webinar? Is it possible to display the slide, please? Or if not, I can just read them out. Yeah, if the slide is not there, let me just quickly go through the key points presented in this webinar right now. So it says, number one, indigenous poultry have been raised for, these are the points made by Professor Alders, been raised for thousands of years, and their persistence indicates that they continue to fulfill useful roles at the household level. Point number two would be to, it's basically extensive and semi-intensive production systems make good use of the scavenging feed resource base. reducing food feed competition with humans. Then improvements to extensive and semi-intensive production systems through better poultry health and production services should be based on participatory approaches and cost sharing mechanisms. And there are three other points which merit mentioning. Consumption of poultry meat, this is more in tune with nutrition. As a part of vegetable-rich diet is associated with a risk reduction of developing overweight and obesity, cardiovascular diseases, type 2 diabetes, diabetes mellitus, and moderately protective or neutral on cancer risk. Taboos prohibiting the consumption of eggs and poultry meats throughout the life cycle should be adequately addressed, especially in countries like South Asia and Southeast Asia. It is very prominent. I mean, it's something which is affecting the poultry industry here in Sri Lanka to a serious degree. I mean, religion and various cultural taboos. And fortified poultry feeds help to minimize existing and emerging micronutrient deficiencies, especially. So yeah, those are the key take-home points from this webinar. And since the second poll was open, there's no sense in discussing that again. So as we have come to the end of the webinar, I would like to again thank.
Sorry. Oh, yes, sorry. Keep going.
Yeah.
Keep going.
No, Professor Alders, you
please
can,
keep.
yeah.
No,
so I would like
I'd forgotten that the poll results had already been shown.
Yeah,
Sorry, go ahead.
Earlier. So yeah, so I would like to thank our wonderful panelists, Dr. Renuka Jayathissa and Professor Robyn Alders, who gave their time and expertise during our webinars this week. Then I would also like to thank our tech team working in the background to make everything run smoothly, and especially Professor Iona Silaflesa and Dr. Danvink, and to you, our audience, for your interest and questions. It's your participation that has really enriched these discussions. And thanks again, and all the best for your ongoing One Health journey. Thank you very much for joining in today. It has been a pleasure moderating the session.